So now I'm going to hand it over to Erin Sullivan, who is a patient here at Boston Children's, and will share her experience in reading notes kind of from adolescence through adulthood.
Great. Thanks, Bobby. Thanks all for having me today. I think we can go to the next slide. Just to give you a bit of context, I have been a patient since birth at Boston Children's Hospital. I've been a patient of the cardiology department, and I am still seen by their adult team, which sits between Boston Children's and the Brigham. I think the first time I became aware of this whole concept of clinic notes was definitely my teenage years. And I think what this slide shows visually is that between being with your parents all the time and then being ready to go out in the world and spread your wings and do other things. And I think it was sort of at that transition point for me of where I was driving a car, going away to summer camp, starting to look at colleges, that my parents really need to make sure understood the clinic note and the importance of it, actually the importance of having it with me when I was not with them because they would not be there to advocate for me. So this was actually before a lot of the technology with being online. And I remember my mom waiting, as I was getting ready to go to college for that clinic note to show up in the mailbox so that I would have a copy to bring to College Health Services, and I would have a copy to keep in my room because it was a great way to catch people up on sort of who I was medically and get them on the same page without me having to remember all the details, or if I wasn't feeling particularly well, me having to remember all the details when I did not feel particularly well. So I think I give my parents a lot of credit for helping me be aware of the clinic notes, helping me understand the clinic notes, and helping me understand the importance of, for me, having them with me and available when they were not, readily available. My parents were not available to me or, in my day-to-day life, so to speak. This became even more important, I think, with experiences in college. There's a relative safety net in that you're in a community and there's a College Health Services who's there and able to care for you should anything go wrong. But I think it was really after college and as I transitioned into school and I had a job for a while that had me traveling to Europe, Africa, and Latin America, that I have a picture on this slide of the bear with the passport in the middle. But like the second thing other than the passport that needed to go in that backpack for me was that actual physical copy of my clinic note that I could have with me wherever I was. And I think for me, particularly some of the travel I did in countries in Africa and Latin America where the internet's not so great and logging on is not so great, keeping that actual physical copy of the clinic note with me at all times was incredibly important to have in case of emergency. So for me, I think there were a number of benefits to having the clinic note physically before all this great technology took over, but then now also that there's technology, there's still a lot of benefits to me as a patient. One is it's like easily accessible. I can take it anywhere. I can put it in a suitcase, backpack. It's there. It has all the latest data on me, my testing, my medications. And I think what's great about not having to wait for the snail mail copy to arrive, which used to take 3 to 6 weeks depending, now they're usually available within a week or less. So I always have access to the latest note within usually a week of having my visit. And I can sort of download it, print it out, and have it there. I think one of the things my parents did really, really well with the clinic note in particular, and sort of stressing the importance of me having that, was having them help me see that it's a tool to advocate for myself with other health professionals. It's written in a language that other health professionals actually speak and understand, and it's a way to say, sort of stop a conversation or start a conversation and remind them that I'm not your average garden variety person with no other conditions that they're seeing. There's actually there's an underlying medical condition that usually needs to be taken into account when we're making decisions about my treatment, and it's there in black and white. can have it with me. It also gave me a lot of peace of mind. I remember when I was in graduate school just telling my roommate, hey, if anything ever happens to me and I get hit by a bus and I end up in the hospital, there is an envelope with Boston Children's like letterhead on it. So bring it to the hospital, or if anything happens, like it's probably going to be important. Gave me a lot of peace of mind when my parents were around that all that information was somewhere. And this, of course, was a little bit before all the accessibility of technology and records. I think the challenges I've seen, there's not that many from my perspective, because this has by and large been a very positive thing, has been that clinicians may not always take the time to read the note or listen carefully, even when you have it there in a clinic visit. You know, they're busy, and there's a lot for them to do during a day or during a visit. So sometimes, even when I had that note, I still needed other tools and skills to advocate for myself. And then I think, you know, accessing via the internet from other countries is sometimes difficult or tricky, or the internet goes down or you don't have access. Or for me, I traveled a lot in remote locations, so that's why I always had a paper copy with me.